Hi, my name is Maya, and I'm an intern at CaroMont Regional Medical Center in Gastonia. The mission there is to provide a compassionate, exceptional, and highly reliable care. The vision is to be our community's most trusted healthcare partner, and the value system is called CaroMont Cares, which stands for compassion, accountability, reliability, excellence, and safety. I am a case management intern in the birthplace, which is made up of the NICU, which is the neonatal intensive care unit, and the labor and delivery units. In the hospital, there are case managers for every floor and every unit, and some are nurses and some are social workers. In the birthplace, I work with the social worker, the nurses, and the doctors. The population we work with in the birthplace is new mothers who usually have social issues that might prevent them from taking their newborn home safely. For example, the biggest problem we see in the birthplace is drug use during pregnancy. And also some mothers we see don't have a social issue, but if their baby is admitted to the NICU, we automatically check in with them to see if there's anything that they need, because we know that it is scary to have your child in the NICU. When a social problem is identified, the doctor or the nurse will put in an order for us to go see the patient, and that's how we get referrals. We can also look in patients' charts and see if they do have a history of drug use or any other social issues, and we can go see them if the doctor or the nurse doesn't put in a referral. There's a wide range of races and ages of the patients that we see. However, a lot of our patients use drugs, are unmarried, are white, and are in their 30s. As an intern, I help to interview the new mothers who I said have a social problem that would prevent them from taking their baby home. Doing this interview helps my field instructor and I to determine whether we need to call DSS to make a report, and in some of the more serious cases to determine if we need to collaborate with DSS to find a safe placement for the baby to go when they're discharged, whether that be home with mom supervised or with a relative or with a foster family. Also, as an intern, some of the baby's cord blood is tested and for drugs, and once we get the results back from that, I call DSS to make reports on any of the babies who were found with drugs in their system, so DSS can follow up with the moms on that. On the micro level, I interact with the patients themselves and sometimes their families. On the meso level, I interact with the nurses and the doctors to get the full picture of what's going on with a particular patient. And sometimes we also collaborate with the other social workers in the hospital if we need guidance on what to do, or if there's a patient that a particular social worker has worked with before. And on the macro level, I interact with DSS, like I said before, making reports and figuring out safe placements for the babies to go if needed. Supervision-wise, it's ongoing during the days that I'm in field because my field instructor and I share an office. So after we go and see a mom, or after we go and talk with a doctor, or once DSS comes or anything like that, we talk about what we heard and process the information together, and she'll ask me questions related to things that I've learned in my BSW learning experience. Like, she'll ask me stuff like, when you asked that question about drugs, did you see how the mom kind of stopped feeling uncomfortable and stuff like that? So that's how supervision works in the birthplace. CaroMont's a really good place to intern in general, and so is the birthplace because it's always busy and there's always something to do. Thank you.